I had my CAR T-cell therapy as part of a clinical trial, and it has very specific inclusion and exclusion criteria associated with the trial. And actually with me, I was included and then I was excluded right until 5 minutes before I got my central line position to have my cells put back in my body. And only 5 minutes before that was due to happen were the final blood results in. That really messes, psychologically there's up and down with the down meant probably I was going to die, and up meant hope of CAR T and life. And that up and down over the period of the bridging was quite challenging.
To be eligible for CAR T-cell therapy, the patient has to have a certain fitness because the treatment trajectory can be intense. So the patients can have cytokine release syndrome, neurologic toxicity. Sometimes that can be quite severe. So the patient has to have like a certain cardiac function, renal function, liver function.
It could be because, for instance, you have an active infection at the time of the preparation. We cannot infuse a CAR T-cell product in a patient who is having an active infection. It could also be because your kidneys aren't functioning properly, your renal function is too deteriorated to receive a CAR T-cell product. It could be because you are requiring supplemental oxygen to be around.
So if the patient is not eligible at that time point for CAR T-cell infusion, we try to improve the condition of the patient to get the patient into a better condition. If the patient is not eligible for CAR T-cell therapy, we have to look at the other possibilities.
If you've been eligible, it's very important to find out why you became ineligible now, because there are different possibilities. So for instance, you may have become ineligible because your tumor grew in the meantime, and of course then our main goal is to treat the tumor and reduce the tumor size at this point. Or to reduce the leukemic cell numbers. And if we achieve that, then you will become eligible again. And the other possibility, of course, is that you've been excluded because of comorbidities. That's a different thing. Then, of course, our goal is to treat the comorbidities. If we achieve that, then you will become eligible again.
Because of the treatment you have received, the antigen that is the target for this product is no longer there. So something that happens is that sometimes with treatments, the tumor cells lose the expression of a specific antigen. And if the antigen is precisely the one that we're targeting, then there's no point in receiving CAR T cells. So if that's the case, then that type of CAR T cell with that target is no longer of use.
Then nowadays there are also very good other treatments that have high response rates, like bispecific antibodies or novel antibodies and combinations thereof. There are experimental trials which you could enter, and there are many other possibilities. It's important that you are treated in an experienced center that is used to manage this type of situations.
It would obviously depend on the reason why you're not eligible for a CAR T-cell product, and depending on that, I'm sure there'll be an option out there for you. But this would have to be discussed with your physician so that he or she can identify the ideal product for you.
I think what kept me going was I never lost hope somehow, weirdly. I don't know how I managed, but somehow I just believed that it would be okay. And it's unreasonable, it's a way too optimistic probably, but it really helped me kind of deal with this up and down roller coaster.